your students make errors, discuss them soon and discuss them privately. Respect them as adults and have them help figure out what went wrong and what they could have done differently. Make them active learners. Put it on them. In fact, I was talking today to a program director in Oregon, and she was doing some exit interviews with her students that never really worked for them. And the sad part is what she heard over and over from these students, that the reason they left was they were being yelled at and criticized for what they did. This is students who left within the first 3 months of employment after coming out of a class. They left because they were yelled at and criticized in front of other individuals. And this instructor said to me, these were good people doing good things in clinicals. So I think if we would have handled them differently, we'd have probably still had them as employees. So I just want you to think about that as you're working with them. Always know what skills they need to demonstrate and foster a climate for learning. Make it safe to learn. That's what clinicals are. If they were perfect and could do these skills and were competent, they wouldn't need this piece, would they? This is a learning environment. They're adults, they need to be respected, and never assume what their learning skills are. I mean, keep having conversations with them about what their needs are, how they're feeling, which brings me to the post-conference. How many of you are doing post-conferences? Invaluable. Cannot skip this piece. It counts in your clinical hours. At the end of every day, you should be pulling them together for a half an hour. You're going to debrief the day's experiences. If something happened that they don't understand or that's troubling them, do you really want them to go home and dwell on it all night and maybe not even show up the next day? Because that happens. Or do you want to help them to at least recognize what they saw and help them debrief it? Review their weak areas or the areas that you saw. Sometimes, it can be a group thing, Everybody, today was doing really good on stuff, but I saw some concerns with body mechanics. Here's some types of things I saw. Here's what I think we should watch for tomorrow. And then give them their residence for the next day if you can. Help them be organized by planning ahead. Now, I know, residents will die. They go home. I mean, things happen that sometimes you have to change their assignment the next day, but that should be the exception, not the rule. For the most part, you should allow them to be prepared for the next day. And then an important part of clinical is evaluation. Number one, the procedures have to be done by the skill sheets. If you allow them to not follow the steps in the skill sheets, when they fail that certification exam, I get the phone call and they'll say to me, well, my instructor didn't make me do those steps when I was in clinical. So do make sure that they know that those steps are all important. And then your learning objectives are really going to help you evaluate how the student's doing. Even the application of objective criteria is affected by the values of the instructor or evaluator. We try to be really, really objective. We're all human beings. So the better your objectives are written, the more objective you can be. And we really want you to be objective and to treat everybody the same and use the same criteria. There are some things, though, the behaviors, that give you some pretty good clues as to whether this is going well or not so well for your students. These are types of behaviors that imply the presence of good professional values. These are what you're looking for in your students, that they're very accessible. You can find them. How many of you have ever had a student who you could never find in clinicals? I have always said that I would much rather have a student who's hesitant, hangs back, than one who's, I know it all, you can't teach me anything, and they just go forth and do, and you can never find them. Those are the ones that always scared me. The priority of activities reflects the residents' needs. They're easily able to adapt their organization for the day around what the resident needs that day. That you hear them explain the procedures to the resident. You can rely on them. They're very responsible individuals, including if they're going to be late for clinicals, they're going to call up and tell you. Willing to learn, they comply voluntarily with the rules and policies. They act in a professional manner. They're pleasant, not only to you, but to their peers and to the other staff of your facility. They complete their documentation. They're able to disagree diplomatically. They take your criticism constructively. They accept the role of others, and they're able to handle conflict with others. You know, there's other things that watch them under stress. Watch them when they have a mistake. Is it suddenly everybody else's problem, or can they accept that maybe they had a part in it? Are they forthright and honest? I mean, honesty goes a long way. If they admit that they didn't quite do something right, or that they were weak in some area, that's easier to deal with than somebody who tries to hide it from you. You observe that they use safe techniques even when they're not aware that you're watching. They do their own work, and they don't represent the work of others as having been done by them. And sometimes that's something I hear about a lot in clinicals, especially when instructors call me up and say they're dropping somebody from a program. This is a common reason that I hear is, well, you know, they told me they did this and this and this, and actually I found out that it was done by another staff member. Their whole attitude with other people and being respectful. Then you have the opposite behaviors. You can't find them when you need them. They're unreliable in the completion of their tasks. You're always having to follow up and double check on them. Sometimes they actually kind of seem hostile to you or the resident. And they're always coming from the who is right instead of what is right attitude. They don't consider the resident's needs when they're planning their care. And they fail to call in if they're going to be late. And they have a pattern of being tardy. They skip obligations if they're not supervised. They pass off to tasks to others whenever possible. Complaining. I know you've seen the chronic complainers in your training programs. That's usually giving you some indication that you've got some issues that you need to work with. And I know that Sharon talked about earlier, we're most likely not going to change these individuals as much as we think we can. They feel that policies are for everybody else to follow, but they're kind of irrelevant for them. And they can be very argumentative with you when you're trying to help them make changes. So some of the other things are, you know, when students lied to me, I always found that very difficult to deal with, or blaming others, sneaking away, being disrespectful, rude. All of those types of things are part of your looking at the person and their success in their clinical area. I do want to take a minute here and talk about filling out the clinical skills checklist, because that's how we know that the person has been determined competent. And so on that checklist, there are columns. And there's the first column is for the date the skills were demonstrated in the classroom part or lab. And then the signature of the nurse who evaluated it being done at that point. You do not need to write out your full signature. You can write your initials, and on the last page of the form, you put your full signature and your initials and the date that was done. Then when it's demonstrated in clinicals, you put the date and the initials of the nurse who observed it for when it was done on a real live person. The way those skill sheets are meant to be, everything that's bolded is going to be filled out across every single column. The things that aren't bolded could be done in the lab, but not necessarily in the clinicals.
Can all these skills really be taught in just 24 hours?
You can do it in 3 days. If you're using stations and you have the students rotate from station to station as groups, if you had one big room set up the way we had station 1 and 2, those 2 stations would take a long time. In the time that those first 2 groups are doing station 1 and 2, the other students could be almost completing all the other stations. Right. And then, or you could have 2 groups completing the other stations and then swap them. I'm very confident it is enough. People are able to do that. That's 3 full days. And the students actually go through the stations fairly reasonable. You know, the first couple times they're a little slower, but once they get the routine down and the mechanisms within their little group, they become pretty efficient at it.
You've been watching Best Practices in Lab and Clinical Instruction, presented by Deborah Buck, RN, Nursing Assistant Program Consultant for the Oregon State Board of Nursing, and sponsored by Acquire Training Solutions.